My name is Felix I.D. Konotey-Ahulu, the Kweji Agre Distinguished Professor of Human Genetics in the University of Cape Coast, Ghana, and recently consultant physician genetic counselor. In sickle cell and other hemoglobinopathies, Phoenix Hospital Group, 9 Harley Street, London. I have received a number of questions on the sickle cell disease patient, and I did answer some on Facebook a week or so ago. And I want to answer a few more. A gentleman sent me a question asking to explain why the degree of yellowness of the eyes, the degree of jaundice in his eyes changes from time to time. Now, the answer to that is, first of all, he did not state the type of hemoglobinopathy that he has, because hemoglobinopathy is having abnormal hemoglobin gene from one father and another gene from the mother. Father gives abnormal hemoglobin and mother gives another hemoglobin, or the same abnormal hemoglobin. So he did not say whether he was SS hemoglobinopathy or SC hemoglobinopathy, in other words, abnormal hemoglobin S and an abnormal hemoglobin C, or S beta thalassemia, or even CC or SF, because as my book shows, the degree of jaundice varies with the phenotype. SS hemoglobinopathy, that's the sickle cell anemia hemoglobinopathy, has more jaundice than the SC. And the SC also has more jaundice when the lady is expecting a baby than when she is not expecting a baby. So there are reasons why the jaundice level differs, and I have shown all that in my book. In fact, on a page on the page dealing with jaundice, I have given 16 different causes of severe jaundice in sickle cell disease. I can't go over all that now, but hemolytic crisis, or gallstones, stones in the gallbladder, or infection. There are different reasons why the degree of jaundice varies. I don't know if the person who asked the question is a doctor or a medical student, but they might wish to consult page 174 of my book. And also, in the case histories, 133 case histories at the back of the book, a description of severe jaundice in some of the patients is given. Now, as I deal with the patient, always remember that circumstances affect the health of the patient. You must always keep a diary and note in the diary what causes you to be suddenly ill at a certain times. I gave an example in the book of a lady, a lawyer, a lecturer at that, who always had a sickle cell crisis when she took a little gin. And it must be gin. She could take beer or wine and nothing happened. But whenever she took gin, as little as a teaspoon full of gin, she would have a sickle cell crisis. So always keep a diary. So that you know what to avoid and when. There was also the case of a sickle cell anemia, a professional, a banker, who did very well as undergraduate, became BSc and went on and got an MSc, became a banker. He would always go into sickle cell crisis if he stayed up beyond 10 p.m. So he would advise at a cocktail party, advise the visitors at the beginning of the cocktail party that he would disappear at 9:30. And he was not ashamed to tell them when they asked, "Oh, why?" He would say, "If I don't go to bed by 10 p.m., I would end up in the hospital emergency ward in the morning." And they would all be amazed at the fact that he had achieved so much with his sickle cell anemia. I shall go on answering further questions when I receive them. Thank you very much.